Many of us have heard about major breakthroughs in the treatment of AIDS during the last several years. Even with these new treatments, there is still no cure for AIDS, and AIDS continues to be a major problem in the United States. Let's meet two experts who will update us on the AIDS crisis. I'd like to welcome Phillip Routon, Yuba County Health Department Education Specialist, and Maneeja Rafiq, got that right this time, Sutter County Health Department Program Specialist. Welcome. Thank you for coming.
Thank you.
What types of AIDS education and prevention efforts are being made in our area at this time?
Well, primarily, I work in Yuba County. Maneeja works in Sutter County. We're doing a lot of outreach type education where we go into the jails, into the schools. I go into the parks and into areas where IV drug users, other high-risk groups hang out. We talk to them about safety, whatever type of practice they're engaging in that's high-risk behavior. We're going into all types of areas where, but really everybody's at risk. It's not necessarily just one high-risk group.
Right.
But as much as possible, our main focus is getting out the information to whoever will listen.
I'm just thinking about that. That must be hard to organize that, to get to these different people and do that, isn't it?
Well, the need's big. And there's a lot of people, and our efforts are limited. We try to ask for volunteers, and if I tell somebody talking to a group of people, I might not be able to reach your friends, but you have a lot of peer influence that I don't have, so they can take the information that we'll present to them and carry on to their peers.
Could you give me an example of perhaps, not naming names of course, but a type of group you'd go to, like this past week, who you would have been involved with talking to, or just an example? I'm just curious.
Well, for example, I've gone to the high schools.
Oh, okay.
I go to Leo Chesney and mental health. There's different locations that we do outreach.
I see.
Yeah, so just to get the word out and educate people on it, make them aware.
The crisis isn't over. We still have to get this under control. Right?
Definitely.
What types of agencies are involved?
Well, primarily, the Yuba County and the Sutter County Health Departments are doing the main thrust of the education and prevention efforts. The Salvation Army has a support group locally for people with AIDS. TRICAP has a volunteer agency that does support for people with AIDS. There's a local agency which is made up of community members called HELP, which is HIV education for the local population. And it's a chance for the community members to be involved with some of the priority planning for getting the education and prevention effort out. And they do welcome community participation with that agency. If they'd like more information, they can contact my office or with Maneeja. Maybe
you can give us those numbers as we get toward the end of tonight's segment.
And also there's interventions that are going on in the schools too. It's part of the education, part of the curriculum, that there's classes that students have to take.
Is this state mandated now?
Yes, it is.
Very good.
So,
I'm glad to hear that.
Yeah.
Yes.
What's the status of this real AIDS epidemic, which is really still going on, and viewers really have to realize that? What's the status of that in the Yuba Sutter area right now?
Right now, Yuba County has approximately 45 AIDS cases to date since around 1981. Sutter County has about 44, and that's just the individuals that have been in to seek treatment or reported it to our local offices. If a person is diagnosed as having full-blown AIDS, that is mandated to be reported to the state, but a lot of people, even from the local area, will go to San Francisco for treatment or out of the area, which is kind of a negative thing in that it might be receiving high-quality treatment, but it really hinders our funding for the local area for education and prevention efforts.
I see, funding based on numbers of cases.
So it is important, you know, that people can come to the health departments or notify the local agencies if they are diagnosed with AIDS. As far as HIV, it's hard to estimate at all how many people are infected locally with HIV or throughout the world, because if someone is diagnosed as being HIV positive, that is not mandated to be reported.
It's confidential, and we can't report it. And like Phil was saying, that those are the cases that we know about, people that have full-blown AIDS.
Yeah, there has to be a lot more.
Yeah, they might have been diagnosed in other areas where they move here and they don't report it.
Right.
So that's still a lot for our county. For example, Sutter County, the population is about 75,000, and Yuba County is about 69,000, 66. So that's
I would
quite a
think
lot.
that those numbers are really low. I think the numbers you've given me, I would think it's much higher, and then the HIV positive numbers are really high too. So, you know, people just have to know and be careful. It's really important. Do you feel that the need for AIDS education and prevention is changing or diminishing in the community?
I don't feel that it's diminishing. I feel that there's a need for it, and that's why we're doing intervention, we're doing outreach, we're going to different locations to educate people on it, because we don't want people to feel comfortable, to get too comfortable with this, because you hear about the medication that's out there, and people are living longer who have been diagnosed with AIDS, but that doesn't mean that there's a cure for it. Yes, it is preventable and it is manageable. That's why we have to give people the education and help them become aware.
Do you see in the community as you go around that because of these drugs prolonging life a little bit, that the attitudes are changing, or are they getting a little bit more free of not doing the precautions and things like that?
No, it's not that. It's just that a lot of them have heard contradicting things. They don't have the exact facts as to what HIV and AIDS is. They've been hearing contradicting things. So, for example, oh, I didn't know you can get it this way. I thought you can get it, you know, so we have to educate it.
Well, who is at risk for getting AIDS?
I think everybody's at risk for getting AIDS. We all are if we do not protect ourselves. For example, unprotected sex with multiple partners, or sharing needles. But if somebody's in a monogamous relationship and they're not sharing needles, then you don't have anything to worry about. But we can't pick at just one target group. I think we all need to be aware of it and seek the knowledge and protect ourselves.
There was a recent case of someone acquiring it from kissing somebody where a person had sores in their mouth, and it may have spread that way. That's somewhat frightening to think about, isn't it?
I know that's the first case that, I know the CDC, the Center for Disease Control, really watches for unusual cases that are unknown as far as transmission. It's not widely, well, that's the first case that's ever been reported as far as transmission. I know that they had severe gingivitis, gum disease, and so forth, and they do recommend that as far as like French kissing, that if individuals are going to engage into somebody that they don't really know, familiar, or are not in a long-term relationship, that people don't brush their teeth and so forth before they do that. Cause
I would think in that case the high school kids and really have to be careful, because of course they're all experimenting with these things, and not all, but a lot of them are, and so they really need this information.
One of the things about the youth of the community, I think that, like Maneeja was saying, to some extent, in my travels and speaking with some of the youth, they are becoming somewhat numb and do have some misconceptions as regards to the transmission of HIV, and thinking that, you know, their science is going to have a cure, but there is no cure. And like Maneeja was saying, the only cure that is there now is education.
Who should be involved in these efforts?
I feel like everybody needs to be involved, the whole community, just like any health promotion. I mean, AIDS is a health promotion, and it starts at home. We need to educate our kids. First of all, everybody needs to get educated, and parents educating their kids, because kids hear, you know, HIV, AIDS, and they don't really have the facts. So as parents and as adults, we need to educate ourselves and educate the children.
Well, this is, to me, an issue that really needs to be continually discussed. This is such an important thing, and I'm glad you're here. If you don't mind, though, I'd like to learn about some of the other activities you do with the health departments, with education and things, because the health department really doesn't go out there and buy big ads in the paper. You do send out letters to doctors, of course, but tell me a little about what's going on.
In what specific
health department education, or other things you might be involved with?
We have quite a few departments reaching into a lot of wide different areas. Most of it's through grant funding, specializing in different areas such as car seat safety and other areas.
I know you're involved with tobacco education, of course.
A lot of tobacco education, and that's really popular right now. And they do a lot of outreach into the schools and with volunteer groups, and anywhere, basically, like with us too, anywhere we can get an audience to speak and share our message, that's our job. And that's what, if any community groups are listening right now and they would like to have some Maneeja or myself come and speak to their group, and we welcome the opportunity, because that's what we're committed to do, is spreading the education and prevention information.
I think also our younger viewers, just another subject is careers in the healthcare field. You've both chosen a career in healthcare without having to go to the many years of medical school and the torture we go through to become a doctor. And you've got a very satisfying thing. How does one get into this type of position? That's interesting. What did you have to do?
Well, that's interesting. We're a little bit of different backgrounds too. My education was in public communication. I really like working with people. It's rewarding to be able to feel that I'm helping somebody even if I could just prevent one person from catching HIV and obtaining the death sentence that comes with HIV. It's worth it to me. I feel like we're helping people by spreading the information there.
So do you have to get a college degree in this first, or what do you do?
We both have college degrees. I went to Sacramento State University, have a 4-year degree from there, and experience in working with community. I have about 5 years experience in working with the community and with public relations and public contact.
And then you have other people in your department who work with you in this type of education, or are you primarily the person here?
The funding for the HIV education actually seems rather low. They barely have enough money to fund me full-time, and Maneeja is only working...
I'm part-time. I've gone to Sac State too, and it's a different. I'm a psychology major.
Oh,
so, but working at the health department, I've gotten the education about HIV and AIDS. It's helped me a lot to get the facts on it, and also through Sutter County Health Department we have different programs. For example, the car seat program. We have a traffic safety, tobacco, dental program. So there's different things that we do, outreaches with the community.
Can different community service organizations like Rotary and others invite you to talk about these other things too? Are there people that will come over and educate about what's available as a community service?
Definitely, we're available for the community.
And most of these services are paid for by your grants or county funding, so they're not a charge for most of these things. So
it's an excellent opportunity, and oftentimes they have free things that they can give away also, like the car seat program. Oftentimes they'll have grants for car seats to help out certain individuals.
Well, what's fascinating to me is I'm being asked regularly about how to get into fields related to medicine and people that don't want to spend 16 years in school, and I understand that. And so here's another way you got into a health-related field and lets you be involved with all of the state-of-the-art things that are going on, and I think that's great. If people want to ask about these careers, could they give you a call at the health department?
Most definitely.
Please do.
Why don't you tell us about the phone numbers of how to reach the two departments? How about Yuba County?
Great. The Yuba County phone number is 741-6366, and they can reach me, Phillip Routon, at extension 6015.
Great. And yourself?
And they can reach me at Sutter County Health Department. The number is 822-7215, and my name is Maneeja Rafiq. Please call me at any time.
Thank you very much. I'd like to thank you both for joining us tonight.
Thank you.
And sharing this valuable information. Hopefully you can come back again and talk about some of the other programs you're involved with. Thank you. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology, cosmetic laser surgery, and liposuction office here in Yuba City with your suggestions for areas and people that you'd like to see on this program. As you know, I'm always interested in hearing from you, and I hope that you'll suggest to your medical doctor or other healthcare professional that you'd like to see them here with me on the Medical Explorer. As you know, we are a public service program, and I really want to hear from you with your comments and suggestions. Please write to me here at Advanced Skin and Allergy Medical Group of Yuba City at 350 Del Norte Avenue, Yuba City, California, 95991. Or you can be state-of-the-art and check out our page with your computer on the World Wide Web. Just log on to www.peppercorn-md.com. That's peppercorn-md.com, and check us out on the internet. In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City, Marysville, and other Northern California areas. For all of us here at The Medical Explorer, I'm Dr. Robert Peppercorn. Thank you for joining us tonight, and have a great evening.